But of my practice, I would say at least 1/4 of my patients would have diabetic retinopathy and complications resulting from diabetic, diabetes in general.
Which essentially means that even if it is skewed, it's quite a high number.
It is a very high number, and if you go by statistics, I think India is already the diabetic capital of the world. Though population wise it may be second, but it has got the largest number of diabetics in the whole world, and this number is only going to go up and up and up, because India is the only country with maximum population below 40 at the moment. Okay, so all these people are sooner or later going to cross that age when diabetes kind of sets in, and we are going to see it's almost like an epidemic scenario.
Do you see stress-related eye disorders in diabetics here?
Stress is an underlying factor in so many diseases. So one disease that instantly comes to my mind is a disease called central serous retinopathy. It is a condition in which water or some fluid starts collecting in the central area of the retina, and it's typically seen in young adult males between 20 and 30, and one of the direct correlation with stress, either they would have lost a dear one, or sometimes they would have lost their job, and within a month or two they come with this disease. So there is a direct temporal relation between stress and this disease. Apart from this, which is a direct cause-effect relation, you have so many diseases where stress is an underlying culprit and often missed.
So what are the actual complications of diabetes on eye?
Yeah, so
rather we'll talk about only the retinal problems.
Retina, yeah. So just in one line I would say that diabetes would affect all the structures of the eye, all the layers of the eye, which is the front of the eye is called the cornea, which is a transparent structure which allows light to go inside, and the deeper structure, the innermost layer of the eye, which is the retina, which is the actual light sensitive layer on which the light falls, an image is formed, and that image is taken to the brain.
Mm-hmm.
So diabetes would affect all the structures, but because I am a retina specialist, I would like to discuss more regarding the effects of diabetes on the retina rather than the other tissues. So the effect of diabetes on the retina is clinically termed as diabetic retinopathy. In the essence of diabetic damage is called as a microangiopathy or a microvasculopathy. What sustained high sugar levels does is it causes destruction of the cells within the blood, which are called the endothelial cells.
Mm-hmm.
And these endothelial cells at the level of the capillaries are just a single layer of cells. So what happens is because of diabetes, some of the cells within the capillaries, they are killed. The capillaries don't have enough cells to plug these gaps, and that's where all the complications start. Okay, so what you get is a leakage from these capillaries causing fluid to collect within the retina, which is called as diabetic macular edema.
Okay.
Because of
leakage, swelling.
Yes, diabetic macular edema is swelling within the center. It often causes blurring of vision in such kind of patients. The next common thing to happen is these capillaries, apart from leaking, they somehow close down, and when they close down, it produces a condition called ischemia, which simply means that there is lack of oxygen reaching the retinal tissues. Now, how our body tries to cope up with lack of oxygen is it tries to build new blood vessels, it tries to build more capillaries, it tries to build new blood vessels, which is called the neovascular stage of this disease.
Okay.
Now, unfortunately, this reparative mechanism is actually harmful to the eye because it cannot function as well as the capillaries, and these new blood vessels then can rupture, leading to bleeding within the retina or bleeding in front of the retina within the gel that fills the eye, which is called the vitreous. So this complication is called vitreous hemorrhage. If diabetes is not tackled and the retinal condition not treated, then it can lead to severe complications like retinal detachment as well, which then becomes a surgical emergency, without which the eye may not be able to survive. We may not be able to salvage the eye. So in short, diabetes is a microangiopathy in which small blood vessels within the retina can start leaking, they can get clogged and lead to lack of oxygen supply within the retina, and this causes myriad of clinical manifestations like macular edema, which is swelling within the central area of the retina, bleeding on the retina, which is called retinal hemorrhages, bleeding in front of the retina, which is called vitreous hemorrhage, and if not treated, then retinal detachment and complications thereafter. So, one thing that most patients have a misconception that diabetic retinopathy is curable. They often feel that the vision will be back to normal, like in a cataract surgery or something. Because cataract surgery, what happens is there's an opaque lens. You remove the opaque lens, put in a transparent intraocular lens, and things are sorted. But in the retinopathy, things are not like that. Now the eye, especially the retina, is regarded to be an extension of the human brain. The layers of the retina also mimic the layers of the brain. Okay, so as brain disorders are irreversible, majority of the retinal damage could be irreversible. That is the most important line which the patient needs to understand, that once vision lost may not come back. Okay, so in diabetics, especially with severe diabetic retinopathy, the whole ball game would be to try and maintain, salvage as much vision as we can, and to a certain extent get back what was lost. Now till few years back, there were not many techniques by which we could give back very good results to the patients, but with the advancement of medicine, newer drugs coming into the market, and with newer surgical techniques, I think a lot of these patients, maybe 60-70% of the patients, do land up having significant improvements in vision in today's scenario. But the patients do need to understand that it is a long drawn process. Patients have diabetes for many years. They would come with 15 years of diabetes and then expect that their disease is going to be, the eye disease is going to be cured in 15 days. But it doesn't happen that way. Sometimes they would be needing treatment for many months or many years until the retinopathy stabilizes. So it's a long treatment. It could be irreversible, but with excellent medicines and improved surgical techniques, there is a lot of hope for these patients now.
Doctor, I think it was the doctor from Aditya Hospital in Macular,
Dr.
Natarajan. So he was saying that it is easy to, you can treat your eye till the time some light is falling on it, and
yes,
you can have that vision of light.
Correct.
But that does not necessarily mean that there is anything reversible.
Correct. So
treatment can go on, but
treatment, yeah, absolutely. Treatment would go on and on and on, and as long as patients realize that the treatment is being done, at least in some patients it would be just to maintain what they have. So the common argument would be that, doctor, you're treating the disease, but our vision does not seem to get better. But the other side of the coin is that your vision is not dropping. So if these patients are not treated, they would actually land up losing complete vision. So that's a very important aspect of treatment as well. So vision gain on one hand and not losing vision on the other hand. These two are kind of two sides of the same coin. So the patient always wants that vision should improve, but we can always argue that, look, your vision is not being lost any further. So these two go hand in hand, especially in a diabetic patient.